Hi, and welcome to Module 4, Lecture 2, Introduction to Community Health. This is week 8, and this week we'll be defining trauma from diverse perspectives, examining the emotional, physical, cognitive, and social effects of secondary trauma, both intergenerational, historical, and compassion fatigue. That's another form of secondary trauma. And researching the role of spiritual cosmology or psychosocial well-being as a medium of understanding and responding to community-level trauma. This isn't addressed as much in the lecture and readings, but we will get to it this week. So your readings and media are Sotero, a conceptual model of historical trauma, implications for public health practice and research. So this has many examples in it, so I thought it was an appropriate kind of introduction to historical trauma and that whole concept. ACEs is really important study, a humongous study, and this TED Talk is all about ACEs, so you'll be learning a lot about it. So you can check out the talk first and then look at the link. And this is a small video about PTSD. Definitions of psychological trauma. So if you haven't gathered already, this lecture will be about psychological trauma and not physical trauma, that is injury and severe wounds on the physical level, but this is on the mental level. So one definition by APA, American Psychological Association, is an emotional response to a terrible event like an accident, rape, or natural disaster. Immediately after the event, shock and denial are typical. Longer-term reactions include unpredictable emotions, flashbacks, strained relationships, and even physical symptoms. Very frightening or distressing events may result in a psychological wound or injury, according to the Australian Society for Psychology. And this trauma can result in difficulty coping or functioning normally. Everyone's reaction to potentially traumatic experiences is different. And I like that in Australia they added this part, as well as the first part about very frightening and distressing events, because it's real and it's more common than we think it is. So PTSD, according to the APA, the post-traumatic stress disorder can occur in people who have experienced or witnessed a traumatic event, such as a natural disaster, a serious accident, a terrorist attack, war, or combat. And some of these things are not one single event. It could be a string of events or living a certain way for a whole year or a number of years. Rape, sexual violence, as we know, can be a recurring act. It's not just a single incident. Violent personal assault, and in conversation with a colleague of mine who is a psychology professor, I've also heard about the trauma that an assailant experiences when attacking someone. So personal assault, definitely the victim is traumatized, but we never, not never, but it's hard to remember that in every culprit, there is also a victim very often. So additionally, during World War I, trauma, PTSD was called shell shock. In World War II, it was called combat fatigue. It affects approximately 3.5% of US adults, and an estimated 1 in 11 people will be diagnosed with PTSD in their lifetime in the United States. Women are twice as likely as men to have PTSD, and there are different things to unpack about this statistic or data that we have right here. One is reporting and seeking treatment. Our guest speaker, who's a therapist, gave a testament to the higher number of women who seek therapy or counseling, and the higher number of men who are in substance abuse treatment at the clinic he was at. And this is sort of, so this number, it might be an artifact of reporting, that women are more likely to report PTSD, or it may be an effect of a male-dominated or patriarchal society where women on a daily basis experience traumas that men do not experience in the workplace or on the bus, or again, bringing back sexual violence or harassment or compassion fatigue, which we haven't gotten to yet, but a condition where being a caretaker, as you know from working in healthcare, is also a way to inherit the difficult, the negative emotions or pain from your patients or your family or your whoever you're taking care of. So we don't know what this is about exactly, but that's what, according to the American Psychological Association. In addition to that, PTSD is characterized by intense, disturbing thoughts and feelings related to the traumatic experience that last long after the event has ended. So differentiating that from normal response, which might be a few days or a few weeks, this of remembering a traumatic event. PTSD is often remembering that for months or years. People with PTSD may relive the event through flashbacks, nightmares, sadness, fear, anger, detachment, may avoid situations or people that remind them of the traumatic event, and may have strong negative reactions to something as ordinary as loud noise or an accidental touch. So we saw the video of Skylar. He looks like a young man. He didn't say his age. He's been in combat and active duty already. He's a veteran. He said his overall experience of combat stays with the person forever, which is probably common experience. For those of you who have served in the military, you can let us know. The fear, anxiety, loneliness, hopelessness that he experienced when he came back, and the alienation from the civilian world was overwhelming for him. Originally, he thought that PTSD was a weakness and did not want to admit or acknowledge that something might be distressing him. But he noticed that his frustration was disproportionate to the problems that he was frustrated over. And it took a lot of other people suggesting, so this is where advocates come in. And so in your other class, you're learning a lot about advocacy, and where just these family and friends were advocates in his life to seek treatment. And he doesn't have a specifically triggering event. It was his daily existence in the combat zone. He does have constant agitation, anxiety, and vigilance, and it turned out once he decided to seek treatment that he had a traumatic brain injury, abbreviated as TBI, as well, and took refuge at the vet center to reconnect with the community. And that was, as he said in the video, a huge part of his healing was being around the community of veterans, hearing their stories, talking about his, and now he wants to be a counselor and a mental health provider. So that's a beautiful story of how PTSD brought him to his life calling. So ACEs, Adverse Childhood Experience Study. So this was a huge, massive study done in the 1990s by CDC and Kaiser Permanente. If you haven't seen this video yet of Dr. Nadine Harris-Burke, please watch it. It's really excellent description of the ACEs study. This is a really important study because it discovered exposure that dramatically, and it discovered that the exposure to ACEs dramatically increased the risk for 7 out of 10 of the leading causes for death in the USA. And this was a 17,500 adults in this study, both traumatized or both who had ACEs and who didn't as controls. So this was a randomized control study. So providing true evidence of, as close as we can get to true evidence on this theory of adverse childhood experiences and how they affect physical health. So the leading causes of death she explains in the the TEDx as heart disease and physical ailments. In high doses, ACEs affect brain development, the immune system, hormonal systems, the way DNA is read and transcribed. So when we're talking about ACEs, we are speaking of children, and so their brains are developing, their immune systems, they're growing, so the DNA replication is happening all the time in their bodies. So a 20-year difference in life expectancy was found between people with and without exposure to ACEs. So this is the ACE pyramid. It's on the CDC website. Let me get this. So the link is on your PowerPoint. So the ACE pyramid represents the conceptual framework for the ACE study. The study has uncovered how ACEs are strongly related to development or risk factors for disease and well-being throughout the life course. So we have conception at the bottom to death. So that's the way this triangle is working. And this is the mechanism by which adverse childhood experiences influence health and well-being throughout the lifespan. So the ACEs are at the bottom at the conception or as a child. So they go up to here maybe for child. Disrupted neurodevelopment as a child, social, emotional, and cognitive impairment later in life, adoption of health risk behaviors as a adolescent and adult when they start to take care of themselves, and disease, disability, and social problems as an adult, early death. And this is the mechanism identified in the ACEs theory. So what are adverse childhood experiences? Abuse, physical, emotional, and sexual, neglect, incarceration of, I would say, of a young person or a family member, growing up with a parent with mental illness or substance abuse, divorce in the family, domestic violence. And this was on the study website. So we have the major findings of the study here, and as you can see, the adverse childhood experiences increase the risk of the following: alcoholism, alcohol abuse, chronic obstructive pulmonary COPD, depression, fetal death, health-related quality of life, illicit drug use, ischemic heart disease, liver disease, poor work performance, financial stress, risk for intimate partner violence, multiple sexual partners, sexually transmitted diseases, smoking, suicide attempts, unintended pregnancies, early initiation of smoking and sexual activity, adolescent pregnancy, risk for sexual violence, poor academic achievement. So we have many risks here. Please take a look at this website if you'd like. And I will see you on part 2 of this lecture. We also have a definition of dose response here, so take a look at that. And I'll see you next time.